Hi guys, this is Dr. Wogu. I am an ST3 GP trainee at Kane Medical Center, in North Devon, United Kingdom. If you are an ST1 who is just starting their GP training, I want to say welcome. Welcome to the specialty of general practice. I think you've made the right decision, because family medicine, or general practice as it's called in the United Kingdom, is an area of medicine that will give you the opportunity to practice, medicine in a very vast way, coming in contact with patients with all forms of needs. Okay, both medical and psychosocial needs. You'll be stretched during your 3 years of general practice training, and hopefully it's going to be a rewarding career, helping people, live the lives they wish to live health-wise. So welcome once again. I've put together a couple of things that I think would help you prepare yourself very early, both mentally and academically. Knowing exactly what is expected of you from the get-go is my goal in making this video. So I've titled this GP ST1 Induction, Useful Materials or References that will be, usually helpful in the course of your training. And the first thing you can see here is what your training map would look like. If you log into your FourteenFish portfolio, training portfolio, and you go to training map, then you would see something that looks like this, okay? You would see something that looks like this. This is going to be your training map, okay? For me, in my ST1, my first year of, placement, I did emergency medicine. First 6 months, second 6 months, I did general practice. My second year, first 6 months was obstetrics and gynecology, and then second 6 months was psychiatry. And currently, I'm in general practice for a year. And this would vary for different people based on the placements and whether your placement is 4 monthly or 6 monthly. Your pathway or your training map or flowchart will vary. But what matters is that if your full-time is 3 years, okay, if you're doing less than full-time, then depends on the percent of, less than full-time that you are doing, then your training will be longer. So this takes me into my portfolio. And I believe by now, most of you trainees will have your FourteenFish portfolio. Something I just want to highlight in your FourteenFish portfolio is when you scroll down, so you have dashboard. When you click on portfolio there, it takes you into something like this. And when you click on your requirements, it brings you to this, okay? Requirements tells you everything you need to achieve in the course of your 3 years. So your ST1 clinical case reviews, you need at least 36. Now, I advise you to approach your portfolio in a tick box approach. You should have a tick boxing approach. So you should know if portfolio demands that you should provide 36 clinical case reviews in your ST1, you need to get at least 36 done. Okay, no stories. To avoid problems, you get 36. Your mini-CEXs or mini-CEX, consultation observed tool, you needed 4, give them 4. Let's see that. Your case-based discussions, consultation assessment tool, they needed 4 somehow because of my A&E placement. It's very easy to get these things done in A&E because you have seen so many patients on acute cases. So somehow I was able to get 7 done in my ST1. And you have to do your colleague feedback. You can see every year. So need 1 every year. ST3 have done that as well. Your colleague feedback on leadership, you only need to do that in your final year, ST3. Clinical supervisor review, something you do each time you have a hospital placement, because usually that's where you have clinical supervisors. In your GP placements, usually you just have your educational supervisor. Okay, if you're doing your placement where in the practice where your educational supervisor is, then your clinical supervisor becomes your educational supervisor there. Patient feedback, you do that in your final year of training, your ST3. And then for your quality improvement project, QIP, you need to do one QIP in the course of your whole training. You can see that just one. And you can do that in your ST1 or ST2 or ST3. It has to be done when you are in a GP placement, primary care placement. Okay? Your QIA, quality improvement activity, anything that you think improves quality of patient care or quality of running your practice. It might be a clinical audit. It could be any other thing that you carry out, that improves the quality of, care overall. And you need to do one in your ST1. So because I did a QIP in ST1, I didn't just do another QIA. In ST2, I did a QIA. In ST3, I've done two, just to make this 3/3. Placement planning meeting is something you would have to do at the beginning of every post. Okay, at the beginning of every year. So placement planning meeting, I needed one per post actually. So I did two placements, two postings, or two placements, rotations in my ST1. So I had to do two, same thing with ST2. And because I'm in ST3 and it's only one post, so I've done one placement planning meeting. Okay. Then learning event analysis, you have to do it every year. Prescribing assessment is done only in ST3. It's done only in ST3. And then leadership project is done in ST3. So you can see once you do it, it becomes 1/1. So let me go back to these. So this is exactly what I've shown you, the portfolio requirements. These are the things you need to do. Okay, you need to tick all the requirements. In the course of your training, as a general practice or family medicine general practice trainee in the UK, you have to pass 2 exams to emerge successfully as a GP, qualified GP. And those exams are AKT, Applied Knowledge Test, and the new exam, Simulated Consultation Assessment, which will be starting in November. It's replacing the recorded consultation assessment. And then when it comes to AKT insights, how do you really pass your AKT? So the AKT is a multiple choice exam. Okay, and you have 200 questions in AKT to answer within 180 minutes. And what does that mean? It means you have less than a minute to answer each question on average. So it means you need to be very prepared. You need speed and accuracy to pass. Okay. And what that means is that you need adequate preparation to actually ace your AKT. I've added a link to a video. Okay, added a link to this video that takes you to my YouTube channel, AKT. Okay, that takes you to my YouTube channel on AKT, and you can, just get a hint of some other things that could be really helpful as you're preparing for your AKT. Now, what are the materials I recommend or resources I recommend you use in your preparation for the AKT? I used the GP self-tests, very helpful. Okay, I used the GP self-tests. So for your GP self-test, if you go there, GP self-tests, and you log in, usually it's your FourteenFish login, your RCGP login. So if you log in there, there's a pick a test, you can see a revision test, or you can do Lucky Deep. You can choose the number of questions you want, and you can start tests. Okay. When you start tests, there are so many questions you can actually attempt. I used the GP self-test. I also used Pass Medicine, so you can always subscribe. But for Pass Medicine, you can get free subscription from your hospital library, usually for 12 months or 6 months. So you can do that twice. So you can get a 6-month free subscription. And if you have to do another 6 months, you can get you can get it just twice. I also did the BMJ on examination, so you could actually do some. So the BMJ on examination, pass your, so you could try some free questions and see if you like the kind of questions. Well, I've come to realize that past tests seems to be more. I think I'll strongly recommend past tests because it looks like the questions in past tests, are representative of what the AKT actually is like. So I will recommend past tests for you. You could actually start early, do a past test subscription, and start going through these questions and familiarizing yourself with, a lot of things that go down, primary care and the AKT. So breakdown of the AKT based on sections. We have clinical knowledge, which makes up 80%, which is 160 questions out of the 200 questions. And then GP administration, which is organization and management. Okay, makes up 10%, that's 20 questions out of 200. And then biostatistics, evidence-based practice makes up 10%, which is another 20 questions. The pass mark for AKT is quite high. You can see here, pass mark of 71, 72%. Okay, which means you actually need to the usual range for pass mark is 66 to 76. But what I've come to observe is that 66, it seems 66 never really happens. It's more 71, 72, 73. That is the pass mark. So that's a high pass mark, which means you actually need to prepare and be really ready. So as I said earlier, the SCA Simulated Consultation Assessment is a new exam commencing second week of November, actually, not first week, second week of November, from the 7th of November. That's when the first, diet of the exam will be kicking off. It's going to be a remote exam, majorly video consultations, it's like doing a Zoom meeting with the patient. And then you have a couple of telephone consultations where you'll be speaking with the patient, but without the video impulse or video input. You wouldn't be seeing the patient. You can only hear the patient. It's expected to be similar to previous forms of the OSCEs. Initially, we had the CSA, there's a face-to-face assessment of actors. And then with COVID, the RCGP moved over to the RCA, the recorded consultation assessment, which gave the trainees autonomy of case selection. You were responsible for selecting the cases you submitted. And then now we have the SCA, which is a virtual form of the CSA, with actors, professional role players, playing the role of patients, and you're assessing them and discussing management with them remotely, either via a video call or a telephone consultation. The goal of this SCA preparation is to improve on your consultation skills while you're in your GP practice, and of course, form study groups so that you make the mistakes early. Your peers will correct you, they'll highlight the things in your data gathering that you missed out, they'll highlight the fact that you forgot to talk about your diagnosis and explain why you're making that diagnosis, and explain in simple terms pathophysiology, how that diagnosis happens. Then, things in your management that you should have talked about. Or did you forget to talk about the fact the patient should not drive after a TIA? Things like that. So your peers would help, find out those things. And you make those mistakes early and you correct them before the exam. So in the RCGP website, there's a blueprint for the SCA, okay? The cases, the clinical experience groups, which is the same clinical experience group in your in the FourteenFish portfolio, actually. So you have a young patient less than 19 years old. You have something that borders on, gender reproduction. It could be LGBT. It could be a patient who has gender dysphoria. It could be a patient who, who wants contraception. It could be a patient who wants to discuss menopause and HRT. It could be a patient who is on HRT coming with postmenopausal bleeding. It could be anything, in that category. Long-term conditions, it could be anything. It could be, it could be hypertension, heart failure, Parkinson, anything. older adults, frailty, mental health, depression, anxiety, psychosis, anything, urgent and unscheduled care, health disadvantage and vulnerabilities, safeguarding and things like that, ethnicity, so EDI, new presentation of undifferentiated disease, that will majorly boil down to taking your history of presenting complaints, exploring, differential diagnosis, coming up with a working diagnosis, and discussing investigations and possible treatment and follow-up. And then investigations, results, patients coming to talk about results. How do you approach this? And I believe the results usually will have some abnormality. You have to probably repeat the tests. You may have to refer the patients, but always bear one thing in mind: patient autonomy. So always check that the patient is happy to go ahead to proceed with what you are recommending. Oh, I think I need to refer you urgently, to the hospital. You should be seen within 2 weeks. And the reason why I'm worried about this is because of this. What do you think about this? Will you be happy for me to go ahead with this referral? Will you be happy to be seen in the hospital? The patient must give the autonomy back to the patient to tell you yes or no. Professional conversation, professional dilemma, could be patients who came in with smelling of alcohol, could be something. A patient who is struggling, a colleague of yours who is struggling, who is depressed, who is abusing drugs or alcohol, something, consultation resources. So I also have this website, which I think is very important. It helps me go through my consultation. So I put things together. There's so many links to the BNF, to the North and Eastern formula, to the GP notebook, to mini-CEX, sign guideline, the New England Journal of Medicine. You can also access your 14Fish through there. You can always go to the mini-CEX from there. Okay? And I've put some useful links as well. So you're consulting, you want to send links to patients on dementia, or useful links they could use, how to access help for dementia, or talk walks for talking therapy, psychological therapy, first response, crisis team, mental health conditions, postnatal depression. You want them to read more about it, to read more about memory loss, exercises for different musculoskeletal problems, erectile dysfunction, patient information. So a lot of patient information leaflets I've added here, bedwetting in children. You can always open that and you can see the link to the ERIC website. You can always just copy that link and attach it to an SMS and send to a patient. So a lot of useful links are added there. Now I'll still add many more links, as time goes on. I've added some other YouTube links to some of my other YouTube channels where you can get more videos on, on how to access your, how to go about your, your 14Fish portfolio requirements. And then added a guide also on YouTube on how to clinical case reviews. How do you go about doing your clinical case review? So, I've come to the end of these very brief induction for ST1. So I really, if you have any clarifications, feel free to drop your questions in the comment section. I'll try my best to reply or signpost you to areas where you can get help. If I'm not able to provide that, I can signpost you and tell you, okay, yeah, you could check this out, or you could check that out. I really wish you a splendid experience, in your 3 years or 3 years plus. For those who will be doing less than full time, I hope you really get to enjoy general practice training, maximize your 3 years or 3 years plus, learn as much as you can learn how to be a good, efficient, and safe general practitioner, in the UK. All the best. Thank you very much.